Hi, let's get to answer some multiple choice questions on Levator ani muscle. 1. The Levator ani muscle primarily forms which structure? A. Perineal membrane. B. Pelvic diaphragm. C. Urogenital diaphragm. D. Ischioanal fossa. E. Obturator fascia. The answer is B. Pelvic diaphragm. This is because the levator ani constitutes the major muscular components of the pelvic diaphragm. 2. Which of the following is not a component of the levator ani? A. Puborectalis. B. Pubococcygeus. C. Iliococcygeus. D. Coccygeus. E. Anococcygeus. The answer is D. Coccygeus. This is because coccygeus is part of the pelvic diaphragm but is separate from the levator ani. 3. The puborectalis muscle is best described as A. Attaching the pubis to the coccyx. B. Forming a sling around the anorectal junction. C. Supporting the bladder neck. D. Closing the vaginal orifice. E. Controlling urethral sphincter tone. The answer is B. Forming a sling around the anorectal junction. This is because puborectalis maintains the anorectal angle essential for fecal continence. 4. The tendinous arch of the levator ani extends between A. The pubis and the coccyx. B. Ischial spine and coccyx. C. Pubis and ischial spine. D. Ischial tuberosity and pubis. E. Sacrum and ischial spine. The answer is C. Pubis and ischial spine. This is because it is a thickened band of obturator fascia. 5. The primary nerve supply to the levator ani is from A. Pudendal nerve, that's S2 to S4. B. Obturator nerve. C. Inferior hypogastric plexus. D. Nerve to levator ani, which is from S3 to S4. E. Femoral nerve. The answer is D. Nerve to levator ani, which is from S3 to S4. This is because it is the main motor supply. Pudendal nerve contribution is minimal. 6. Which action is mainly attributed to the puborectalis muscle? A. Urinary continence. B. Vaginal support. C. Maintenance of anorectal angle. D. Elevation of coccyx. E. Closure of urethra. The answer is C, which is maintenance of the anorectal angle. 7. Damage to the levator ani during childbirth most commonly results in A. Vesicovaginal fistula. B. Stress urinary incontinence. C. Pelvic organ prolapse. D. Rectovaginal fistula. E. Dyspareunia only. The answer is C, which is pelvic organ prolapse. This is because loss of pelvic support leads to cystocele, rectocele, or uterine prolapse. 8. Which artery contributes to the blood supply of the levator ani? A. Superior mesenteric artery. B. Inferior epigastric artery. C. Internal pudendal artery. D. Femoral artery. E. External iliac artery. The answer is C. Internal pudendal artery. 9. In females, which additional opening passes through the levator ani? A. Rectal hiatus. B. Vaginal hiatus. C. Perineal opening. D. Ischioanal opening. E. Pubic opening. The answer is B. Vaginal hiatus. 10. Which muscle lies lateral to the levator ani muscle? A. Piriformis. B. Coccygeus. C. Obturator internus. D. Gluteus maximus. E. Psoas major. The answer is C. Obturator internus. 11. The iliococcygeal muscle primarily inserts into the A. Pubic symphysis. B. Perineal membrane. C. Anococcygeal ligaments and coccyx. D. Ischial tuberosity. E. Sacral promontory. Answer is C. Anococcygeal ligament and coccyx. 12. Which function is lost when the levator ani relaxes? A. Micturition. B. Defecation. C. Vaginal delivery. D. Pelvic organ support. E. Anal opening. The answer is D. Pelvic organ support. Thanks for listening, and do not forget to like, subscribe and share if you found this video helpful.